Hello, hello. How's everybody doing? Hang tight here. Hey.
Hello, hello.
No, just waiting for Josh to come in and everybody else. Let me just see if he got the. Let's see. Lindsay, give me a second. So he confirmed everything, Coach Lindsay, for the call.
Uh, I haven't been emailing him because I thought you had done that because you didn't say
How
it.
how did you communicate with him? Sorry, I'm confused. I thought that you had talked to him because you got his photo, no?
I got his
Oh,
photo
there it
through.
is. Okay, never mind. Okay. I'm like, what the heck is going on? All good. All right, all right. This is how it goes this the time. I'm like, I thought that you took over this, girl. Like, no. Hey, Josh. What is going on here? Let me
There
see.
we got it.
There you are. How's it
We made
going?
it.
Good to see you
Good
again.
to see you girls. How are you?
Good, good. We're just gonna wait a couple of minutes here just to see, with the staggers. But
Of course.
most of the people, most of our clients watch this later. I guess it's just time, for
Fair.
them. But it's all good. So normally I wait until 5:05 and then we get this party started.
I love it. Bear with me. We have a storm, so if I lose power or internet,
Oh no.
I'm giving you a heads up now.
Oh no. Oh no.
So far so good though. Only a little flicker, but that's been it so far. So hopefully that's it.
Yeah. So you were in Florida, right?
Yes, I'm Boca.
Ooh, how nice. Where are you,
Boca.
Tanya?
What's that?
No, I have a client on a call that she's in Florida too, right?
Oh, the
No,
South Florida area?
my mom lives down there. I talked to Josh a few months ago, and my
Yeah,
mom's
yeah,
down
yeah.
near Boca. So I talked to her tonight. She said how bad the storm was right now.
Oh,
Yeah, it's been all weekend.
Yeah.
wow.
Yeah, we're trying to stay dry.
I
But
love
you
it.
know what? It's been so hot over the summer. I'm not even mad about a little rain. That's for sure.
Right. Well, but it's
Well,
always does, right? Over there in Florida. I
what,
love that place. Oh my gosh. I haven't been there this year, but every year I go and I spend a few weeks there.
well, next time you're in town, you gotta let me know. I gotta let you
Of
stop by
course, for sure. Soon, soon, soon.
for
All
sure.
right, just a few more minutes here. Let's see. Oh, Radha's on the call. Let's go. So, we're good. Can you believe that my mother-in-law just fell again? She's
Like
actually
today,
on
today,
today,
recently.
right now. She's on the ER right now.
Oh my goodness, I'm so
I'm
sorry.
like, what the heck? Like when are you like one fall after another for all these years, man? It's like I don't get it. That's
She's
why I'm
keeping.
like,
She's got to keep you on your toes. Can't make it too easy for you.
I know, right? Uh, yeah. Yeah, let's get those peptides for them so they can,
I got just write my reminder now. I'm gonna put that in first thing tomorrow.
yeah, put it in because now she's gonna probably need, at least on that knee, right? Once she start taking that BPC, she's gonna probably feel better right away because it's a
At least
fresh,
for the yeah, at least for the any inflammation that she's got in there should help and subside that as well. Soft
right?
tissue repair, things like that. If she did, God forbid, have
Yeah.
any minor tears or bone
Okay.
bruising or anything like that.
Love it. I love it. All right, so let's get this party started. I am always excited for this call because we get to hang out and help you ladies the best way we can. We have Josh in the house and super excited to having him one more time here because the more that we, continue coaching, continue in this wellness world, right? Especially now with women in perimenopause and menopause. I mean, this peptides, couldn't come at a better time, to be honest, because I have been doing this for years on end, and I've always been able to see progress just with nutrition, proper nutrition and macros. And honestly, especially now after turning 50, 40, I wish, after turning 50, I really realized that, man, we do need all the help we can get. And I was very, very stuck just a few months ago. And I messaged Josh and I was like, whatever the heck you have, just give it to me, because nothing that I'm doing is working right now. And I know that I need to, optimize things. And so we started working with a peptide that, we will share a little bit about that. And just a little story here, back in April, I became estrogen dominant, my gut started to flare up again, and I gained 8 pounds just like that overnight. So once again, came back, I had a surgery, as you ladies know, and did a protocol, functional protocol, and things were not moving. And I was getting very frustrated. And I talked to Josh and I said, what do you got? I don't want a tirzepatide. I don't want to, anything like that, but I would like to have something to help me, because even my insulin was actually high for the first time in my life. And so we did talked about this new peptide that he's going to be sharing today, and I have been on a very, very, very small dose, of it for, I don't know, 6, 7 weeks. Probably lost a couple of pounds, and but what I noticed for me the most has been the inflammation. Just, I was so inflamed. I was so, retaining water. It was just, I don't even know. I can't begin to tell you, because I was already doing everything that I knew how to do. But this peptide helped my body just calm down. So that has been amazing. And then just recently, and once again, this is not a magic, girls. A lot of people think this is a magic. It's not a magic pill by any means. And then I had to realize that I had done my GI map, back in April, and I had been diagnosed with a leaky gut. And even though we did a gut protocol, I knew that something else needed to happen, that it was like a missing link for this. And I talked to Josh again, and he put me on this trifactor, whatever name it is, which is now supporting my gut. And just step on a scale today, and my waist is down 2 inches since we started. So I'm like
Yes,
feeling
I
like
love
myself
it.
again, which is awesome. So anyway, so I just want you to come in and share with those girls, because we have had, a few clients that are taking the peptides with you, doing the nutrition, the training, they are all dialed in, and they are feeling amazing and starting to look even better. And I am one of those that, if, we can do everything properly and we add those tools, it would support so much. And we see so many women dealing with gut issues, and I would love to share for you to share more about this powerful peptide for gut health, and then everything else.
Absolutely. Well, you nailed it with there's no magic pill. So I tell everyone in the consultation, this is just a supplement to other lifestyle habits. So the exercising, the diet modification, the eating habits, it's just a piece to the puzzle. So these peptides are going to work optimal and more efficient when you do obviously what you put into it with the exercise and diet modifications, like Patricia just stated. So just to start with the top, with the tripeptide, Patricia was discussing, it's the KPV. It's KPV, BPC, and TB500. So these are three different peptides. Just to kind of give you a breakdown, the KPV is a tripeptide. It's comprised of three amino acids: lysine, proline, and valine. So this is going to help with regeneration of GI tract, um, inflammation, IBD, great benefits with that as well. Crohn's, ulcerative colitis, things of that. It's a great for gut health, gut cleansing. With that, you have the BPC 157, also has great effects with the reducing and inflammation, also has great soft tissue repair benefits as well. But not only that, It's going to help with protection of the gut, ulcers, leaky gut, intestinal inflammation, things of that. Then you have the TB500. Like I said, it's another peptide, more for soft tissue repair, speeds up recovery, cell migration, moving the cells to the injured site, helping with the recovery and speeding up the recovery process. So these three different peptides kind of coexist and work together. Um, to help with inflammation throughout the body, any sort of gut inflammation, GI problems, ulcers, Crohn's disease, IBD, all the above. Like Patricia said, we've seen a lot of great results with anyone with those kind of stomach and gut issues. As we know, gut health is a huge thing to kind of hone in on and address as we kind of get everything else kick-started. That's a great way and great base point to start. And that's what we did with Patricia first and foremost. And as she said, she's seen really great results, which only makes me even happy to hear that. So like I said, kind of a lot going on as far as the peptides. Like I said, we do have BPC by itself. We do have TB500 by itself. But the peptide Patricia has addressed, which is the tripeptide, has the three compounded together. Typically taken subcutaneously, 5 days a week, I should say. Um, I said easy administration. Like I said, very good results, seen really good benefits, especially in the gut and the GI problem areas.
One of the things that I noticed that Maria was asking me as we were talking the other day, I I don't know, the last couple of weeks I started to have a flare up on my sciatic. And every time I try to push my body a little bit more, it ended up happening. It ended up happening. But I was just like, oh my gosh, I can't believe I'm gonna go through this again. Like when I finally get my body to move, then I get an injury, right? That flare up. And I took then that day I received my peptides, and I had read that the BPC supports with repairing injury. Like I would love for you to share a little bit on this, because I've seen also this another big issue with our clients having how can I say, frozen shoulder or this kind of injury or a sciatic or that kind of injury. So, back issues and whatnot, and knee problems. And I kid you not, girls, you don't understand. I was in so much pain. I was already like searching which chiropractor was going to see, what kind of medication I had to take because I was in pain. And long story short, I took the shot and I, put it closer to, my glute area. And I'm not kidding you. The next day I had no pain. Okay, like gone, 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 gone. Now the other day started getting a little bit sore, but I was, taking the shot every day for 5 days, and I have no more pain on my sciatic. And normally it would last a good 2 to 3 weeks before I can recover from that pain. So, talk a little bit about that, Josh.
Yeah, like I said, like I said, as far as the wound healing properties of BPC, I can't rave it enough. Like I said, soft tissue repair. I like to, for example, what Patricia just discussed, if there is a specific site injury, like the sciatic, I have other patients that have shoulder issues, knee issues, hip, ankle. I like to try to get the peptide as close to the injured site as possible. Now, the peptide is meant to disperse throughout the body and find the inflamed area. I like to give it a little head start. Like I said, if it is an isolated area like Patricia's sciatic, or like some of my other patients, I had someone come in with an elbow reconstructive surgery. So we're going either that delt or closest to the tricep. Um, Closest to the site if possible. Like I said, haven't taken daily, but again, great results with the soft tissue repair, reducing inflammation. I can't tell you how many patients I've had get on it either prior to surgery to
Mm.
keep the inflammation down, and then we keep them on right after surgery to speed up the recovery time. Like I said, with
Wow.
the reducing of inflammation, and like I said, the soft tissue repair, tendons, ligaments, muscles, even bone healing qualities. Like I said, just a really good peptide. TB500 is another one with a lot of similar benefits. Like I said, soft tissue repair, reducing inflammation. Two different compounds, but like I said, we do have a compound of them together. They work really good synergistically. So I have a compound, like I said, with BPC and TB together. But I have some patients that are doing just one or the other and seeing really good results with it as well. But what Patricia's noticing and experiencing is I hear it all the time, especially like I said, with patients coming out of a surgery, or maybe it's just a minor tweak or pain that they've been kind of chronic with, reducing that inflammation and then speeding up recovery process. Except if there's any soft tissue damage, speeding up that repair as well.
Wow. So I got from my gut, but actually can help with injuries.
Absolutely. Like I said, I've had patients, breast augmentation, a really good close client friend of mine, had theirs done. Couldn't quite get the right side of her arm up all the way to her head while the left one was all the way up. 7 days, 10 days, she saw a dramatic difference in the range of motion just by reducing that inflammation.
Wow.
Again, then my other patients coming out of surgeries, going into their orthopedic for their follow-up and way ahead of schedule, except with the recovery time and speeding that process time up. So again, I can't rave it about. That's probably one of my favorite peptides. I've had two ACL replacements back when I was in high school, and I wish I had these then. I had to do
Wow.
the old school method and just kind of bear and grit through it. But if I could have had these peptides then, I would have jumped all over it. Like I said, just can't say
Oh
enough
my
about it.
gosh, it's driving me crazy that I did the surgery in Brazil. If I knew, because I wasn't 100% sure, I was like, we'd be so ready.
Back on your feet.
That's crazy because I suffer through that. My goodness. But now I know if you're gonna get ready for a surgery, I'm gonna say this to a client that is gonna watch this later. She had a cycling accident and she broke her jaw and she's like, iron, like everything shot right now.
Yep.
And now you were saying this, I'm like, girl, you need to get with Josh and you need to start working on that
It's
because
crazy. I had a patient earlier today, going in for a jaw surgery. I don't think it was a bicycle accident, just a jaw surgery. And we got her refilled on her BPC. She knows the drill. She's been on it for months. Was traveling, took some time off. She goes, Josh, I have a jaw surgery coming up in October. You know what to do. Put the order of BPC in. And
yeah,
she was right on point, ready for the drill. So, like
that
I
is
said,
the
just kind of staying ahead of it, keep that inflammation down, and then even staying on it after the procedure to speed up the recovery time, keep the inflammation down. Again, just speeds up everything, the whole process that much better.
Okay. So, obviously we're gonna open up for questions, girls, but before, we go there, do you mind sharing a little bit about you, Josh? Obviously we didn't even, get to introduce
Uh,
you properly.
we just jumped right in.
I know, right? Just, no, just,
Which I like. I'm okay with that.
yeah, just, introduce yourself a little bit, like,
Just head first.
what do you do? Like, why are you here talking about
Fa-
peptides? Who are you? That kind of thing.
Fair enough, fair enough. So I guess a little background. I mean, I've been in the health and fitness industry, oh goodness, 15 years now. I did personal training, really kind of di deep dived into, like I said, the fitness aspect. Did my own nutrition. I did my pro card and bodybuilding. So with the training and the dieting, things like that, and then the supplementation that kind of came into terms with it as well. Um, Started working with another clinic maybe a year, actually 2 years ago, and really kind of dived deep into the peptides and just the longevity and anti-aging, just kind of really immersed myself. And then 2 years ago, actually next month, opened up my clinic with a couple of my partners. And just like I said, it's been nothing but a joy. It's a constant learning experience, as you guys will find out. There's new peptides coming out all the time. And like I said, as research is coming about and all these peptides are being fine-tuned and tweaked, more information is just coming out more and more. And I guess I try to immerse myself in as much as possible. And you can get yourself in a rabbit hole. I tell patients I'm all about giving you my knowledge, but I encourage everyone to do research and come back with me and kind of have an open table discussion about what they found, any questions they have, because I said there's so much information,
Yeah.
and there's so many different peptides out there. We have probably a handful, maybe two handful of peptides that we use on a reoccurring basis, but there's just hundreds of others out there.
Yeah.
And like I said, just the personal experience with it, like I said, with my own aches, pains, my own longevity, my overall well-being, the things I kind of put myself through, and just sharing that with other people, seeing their success, listening to Patricia, how she's feeling, how she's doing it. It make that's kind of really why I got into this, is hearing those success stories, seeing people change for the better, feeling better, looking better. Again, that's what got me into the industry.
Got it. And how, you know, how do we, like, I know that obviously you have a pharmacy, right? That you guys prescribe this, your partners, I think. And how do we know like the quality of your stuff? Because,
Yeah. So it's a great
I
question.
trust you,
No,
I'm
no, but it's a
working
good
with
question. I'm
people a
glad you brought
lot.
it up because a common question I get and what people are seeing now, since these peptides are becoming more readily available, they are kind of trending in a way. More and more people are hearing about them. They are catching traction, which is great. But
Mhm.
with that, you're seeing these kind of ads on social media. You may be getting emails of these peptide sites. There's tons of them out there. I get them passed along my way all the time. The thing that I tell patients to look out for with those sources compared to the pharmacies that we deal with, if you see those vials on those sites, on the label, you'll see for not for human consumption, experimental use only. That's their loophole and gray area. They're not, they don't, they're, you don't know what you're getting. You don't know how they're compounded, whether it's a sterile facility or not. The dosing, this, the authenticity of it's kind of, again, it's not regulated. So I just tell patients be very careful. We go through regulated pharmacies. I share those pharmacies with patients when they do receive their medications. Encourage them to do their research with those pharmacies. They have websites. Everything's on there, but they are regulated. What you're receiving is exactly what you're ordering. The dosing's correct. Everything on there. So again, it's more regulated. It's compound pharmacies what you're getting. I spoke to a guy the other day. He was kind of had a similar office that I did. And shockingly enough, I got to ask him about some of the pharmacies he was using, and he kind of paused and I don't use a pharmacy. We get them shipped in from China. And I paused and I was like, well, what do you mean they get shipped in from China? Well, then we have a third party that tests them. And then after that is when, and I'm like, are you really? And he was like, yeah, but it's just been a little difficult because sometimes they're working, sometimes they're not. And I'm like, this is exactly what I've told these patients to be careful of. These are they're unregulated peptides. You're kind of rolling dice of what you're getting. The dosing could be diluted. You don't know the facility they're being compounded in. That's kind of the gray area. I went over the process that I put with my patients, putting scripts through the pharmacies, having that discussion and conversation with pharmacists. I am in a first teach basis with them. Any of the patients have questions for me, I could always go to the pharmacist with those questions as far as dosing or compounds. I have that connection relationship with them, whereas you have these other sources that are getting them from China or God knows where. And like I said, just the unregulation of it's a little concerning, I guess you could say. But like I said, we have a handful of pharmacies that we do use and are regulated. And like I said, what you're ordering is what you're receiving, and all of that is very closely monitored.
Love it, love it. Yeah, because when I get the packages always come with the name of the pharmacy and all.
Yeah, yeah, yeah. You'll have the name of the pharmacy right there and it's a prescription. Like I said,
Yeah,
that's
it
so
is
my
a
patients
prescription.
that do
Yeah, you're,
travel, I
yeah.
tell them to take the prescription with them. These are prescriptions. You are able to travel with them. I can't say that with some of these other peptides they're getting from these sites and who knows where. But that is also another thing with all my patients, especially that we just got through the summer. I had quite a few patients traveling. Their concern was, am I okay to bring it with me? And I
Yeah.
said, bring the box with your prescription on it. Your name's on there. That is your prescription. It's signed by our medical director, and they've had no issues whatsoever. And I can't say that would be the same if you got it from another source.
Yeah, I love it. I love it. Thank you for clarifying that with us because,
Of course, bro,
from
great
where you're
question.
getting this, it's super important. So, I have another question. Let's just talk about the new GLP that hasn't been really released yet, but it is, who is prescribing these peptides?
So I think you're talking about the retatrutide.
Yeah, we just have a
So
quick question here on the
yep.
comments since we're still talking on that. Who is prescribing these peptides?
I have a medical director. Our medical director is Dr. Glenn Charles, and he's our prescriber.
Yeah, actually,
I'm not a doctor, by the way, just so we just so we
yeah,
clarify.
when I received the peptides, his name is on the medication.
Correct. Yep. Correct. Yeah, he's
Is
our prescriber.
he an
Correct.
MD?
What's that? DO. He's a DO.
He's a DO.
Correct. So I work alongside him. We review labs together. We go over the protocols, dosing, things like that. Him and I are pretty much attached to the hip, in the sense of coming up with going through the consultation notes, making sure that everything is notated on file, and then like I said, going over any labs, things like that, any questions. You usually will deal directly with me, but I always have him available if you do need a question directly to him. But I said I'm usually the main source of contact, and I work directly alongside him as well.
Love it. Okay. So, let's talk about now, let me just see if there's any question. Okay. Let's talk about the I
Ready?
can't say the
Ready? Come
name.
on.
Retratide. What is it called?
Well, it's close enough.
I call it, ratatouille.
Reddit. I actually like that one. I actually like that one better.
I call it ratatouille.
Ratatouille. I like that. That's the new nickname.
Uh, what's it called?
Retatrutide.
Retatrutide.
Yeah,
So let's talk
it's
about
a
that.
mouthful. It's a mouthful. All right, so
Yeah, yeah,
just for an example, you guys have probably all heard about semaglutide or Ozempic. Ozempic is the name brand. The semaglutide is the compounded medication. That targets the GLP-1 agonist receptor. Then came along the tirzepatide, which is the Zepbound or Mounjaro. Step above targeted two agonist receptors. So it was the GLP-1 and the GIP. So everyone's like, great, stronger medication, better results, better toleration, awesome. Well, obviously, there's always something bigger, better coming down the pipeline, and now we have retatrutide. So it is still in the testing phases with the FDA, so it isn't FDA approved as of yet. We're anticipating beginning of the year that to be coming out FDA approved and put on the shortage list. In the meantime, we do have one pharmacy still that's compounding it, but it's a triple agonist peptide. So it's going to target the GLP-1, the GIP, and the glucagon receptor. So three different receptors compared to the one or the two. Um, People are seeing about 24% of body weight over across a year of course reduction. But not only that, but better toleration, better response with the insulin sensitivity, regulating blood sugar, promotes fat burning. But the biggest thing I think I've been seeing and hearing with the retatrutide compared to the others, and Patricia and I discussed this, and which is a lot of people's concern with the other GLPs, is the reduction of lean muscle mass during course. So what the retatrutide people are seeing and studies are showing the preservation of lean muscle during the course of the weight loss. So that's been huge. So you guys probably, if you have any friends that are on GLPs, you probably heard, "Hey, I lost a bunch of weight." A lot of it came from the lean muscle. So most of that may be because they did too high of a dose, so they weren't eating at all. So they weren't getting the proper nutrients, proper protein intake. That's usually the main source right there. I'm a big advocate. Patricia will vouch for this. My goal is to keep the dose as low as possible to reach our goals. So there's no race to the max dose. If we can get you to your goal at the lowest dose possible, that's where I want you. This is no substitute to diet, no substitute to exercise. This is a supplement to those things. So
Mhm.
with the combination of all three, I've seen really good results and effects with it. The medication is meant to suppress the appetite, not eliminate the appetite. So, like I said, small dosing, especially the first few weeks of the course. Like to see how the patient responds, how it's tolerated, and then we increase as needed. So, some patients stay on a dose longer than others. Everyone tolerates and responds to the medication differently, but it's really closely monitored based on your toleration, and it's adjusted as things go forward.
Got it. So Mary asks, since both minimize hunger through hormones, how is this different from semaglutide slash Ozempic?
So, like I said, the semaglutide targets solely the GLP-1 agonist receptor. This retatrutide targets the GLP-1, the GIP, and the glucagon receptor. So it's a triple agonist GLP medication. So it targets three compared to the Ozempic, which is just the one. And as most of you may have heard, that's where a lot of people had the side effects, the nausea, acid reflux, indigestion, all those sort of things. We're seeing much better toleration with the retatrutide, very minimal mild side effects. So that's been helping as well. And then I said the biggest thing is the muscle preservation during course. I can't tell you how many, that was the biggest thing with the semaglutide tirzepatide, keeping the lean muscle on while doing the weight loss course. And like I said, the retatrutide's been shown and showing really good results with that.
Yeah. I love it. So we have 30 minutes into this, and I think this calls are much productive when you ladies are asking questions like that. So if you want to unmute yourself or ask any questions, go ahead. I know like Surabi had a question there. One of the things that, we do have clients on on semaglutide on the program, and, even for a couple of years now. And the biggest challenge, has been really to keep them eating properly. Because one of the things that I noticed is that women is a very interesting individual. It's like, as long as I'm losing weight, I'm
True.
happy, right? I don't care what it's taking. I just need to be losing weight, right? It's crazy. And so they tend to forget once they start losing the weight, because some of our clients really came very, very stuck. I mean, huge problems with their blood markers. The body just doesn't respond to anything. And when we fix their gut, we start working with gut regulation, and we start working with optimizing their hormones, then we were able to put them on a medication, and they were able to see results. But then they tend to, not eat as good, right? Not log as properly, not, and I'm like, got a girl, you don't understand, right? Don't fall back into the idea that just because you're losing weight the healthy way. Does that make sense? So I really wanted to like stress this, because we see all these lawsuits that is happening, right, with Ozempic and all of that, and people, getting so afraid, around this. Let's talk a little bit about that, because we discussed this a few times before. What is
Mhm.
going on with people that are going, sick, getting, all kinds of problems, and now they are
Yeah,
doing.
you're seeing a little bit more, especially geared more towards the Ozempic and semaglutide, with some of these side effects that are coming about. Like Patricia said, we don't know the other variables that were involved. I like to use the medication as an as needed dose. So again, a supplement to your lifestyle, proper exercises, dieting. I'm not trying to it's not a race to the max dose. So just I like to do a nice conservative dose as we go along, chip away the body weight. It's also going to be easier to keep the body weight, the weight loss off when we come off the medication when you do it slowly. These drastic weight loss, 30 pounds in 2 weeks, things like that, these big yo-yos, a lot of times that weight comes right back. So I've noticed doing it very conservatively with low dosing has the patient time to adjust to those lifestyle changes. So when you do come off this medication, you continue with the exercise, you continue with the small portion meals, not eating the fatty foods or the fried foods, the things you weren't eating during the course of the medication. It's
Yeah.
instilling those lifestyle habits. So like I say, I try to keep people and focused on the long term,
Mhm.
and keeping that in mind. I get it. I know, it's hard to, I want the weight off now. I don't want to wait that long. I want to get it done now. So I do understand that, but when you keep the long term in mind, it's just better. It's healthy to let your body regulate itself and adjust as you're losing that weight. Again, you want to keep this weight off when you come off this medication. That's the goal it keeps in mind. So with these crazy things are coming about on with these side effects, I can only imagine what the kind of dose they were on, what are the pre-existing conditions they may have had that they may have ignored and continued on anyways. There's
Yep.
a lot of different variables I'm waiting to see. Like I said, but as far as my protocols and the way I set patients up with is low conservative dose. If I can get you to your goal weight at the lowest dose possible, that's a win for me. And I will do across a course of numerous weeks. knowing that once you come off this medication, the chance of you staying on that goal weight and staying on that path is a lot likely than you
Mhm.
losing 30 pounds in 2 weeks, coming off, and that weight most likely coming back and tenfold more.
Yeah, I love that. Yeah, because this is the thing that you need to understand, right, girls? Like, if you are stuck, okay, so let's just say, you did everything right. We got the nutrition where it needs to be. You're hitting your macros, you're doing your training, you're working on stress management, and that thing is just too there. Okay. We know that we do have some weight loss resistance and insulin resistance, and we know that this is probably happening, to be very truthful, with you being dieting, chronically dieting for many, many years, okay, really shutting down your metabolism. And now we need a lot more than 6 month time to reverse the metabolism. Like, for some people can take up to 2 years for us to actually reverse the metabolism, because they have been on this yo-yo chronic dieting for so long that they destroy their bodies. So now, if you start taking this medication, and you, like Josh said, just for the support with your insulin resistance, just for the support of minimizing inflammation, not for the sake primarily of just dropping a ton of weight, but just so you can optimize the body to respond to the protocols, to the things, the nutrition, the training that we are doing. Does that make sense? So in other words, with the clients that I have, Josh, I go through a reverse and a cut with them when they are on the medication. Does that make sense? They don't stay on a calorie deficit the whole entire time. We still put them through the reverse, because I'm like, there's no difference. I know you want to lose weight, but I'm not going to keep you eating on a low calorie deficit the whole entire time.
Mhm.
Right? So the goal here is to keep your blood sugar in a good level, to keep you moving in the right direction. But we are going to still do a reverse. We're going to keep building muscle in the process, and then we're going to go back to a cut. And then your body's going to respond in a cut, opposed to not respond when we tried it before. Does that make sense? So
Mhm.
it's not about the race like Josh shared. It's really about, do I need anything to help me optimize because I'm stuck, but not for the sake of dropping, 10 pounds because I have a vacation to attend in flipping January. Right? So you're using this as a true tool to support your health. Does that make sense what I'm saying, girls? So Surabi is asking, why get compound versus waiting for FDA approve and getting it from my physician?
Yeah, you could do that as well.
Yeah,
Like I said, there's no harm or in waiting for it to come out, be it FDA approved, and
yeah,
if your insurance will cover it, obviously it depends on your insurance and your physician whether they'll cover that. Yeah, there's no harm in waiting for that to come out. Like I said, I
yeah,
think they're predicting, I mean, this is tentative, things can change, but I think by the beginning of the year, they were hoping to see that being put on the shortage list. So yeah, like I said, there's no harm with
yeah,
that to wait and hopefully, have maybe your physician prescribe it or maybe your insurance will cover it. It will depend on, I mean, I'm assuming with how they did it with Ozempic and Mounjaro, depending on your
need,
insurance and provider, whether they'll cover it or not.
yeah,
And that's usually where we came into play. So there was just some patients that weren't a candidate for insurance to cover that medication. So they had no really other rhyme or choice. That's where we came into play. We came in step foot and they don't use it. We don't cover insurance. So they went through us.
yeah. And the other thing is, at the end of the day, I think it's really about, how much of this is prescribed, right? Doctors are not supporting these clients, these patients, or whatsoever. They are just prescribing the drug. We have clients that are getting the medication from their physician, and every other week or so they keep bumping and bumping and bumping and bumping, and I'm like, why do we are losing weight? You don't need to bump this thing. Like, just stay where we are. And the end of the day, I don't, and it's approved, right? It's FDA approved. It's not, to me, obviously, being FDA approved, it has the extra,
Credential.
safety, right, credentials. But at the end of the day, Ozempic was approved by the
Yep.
FDA, and it's still making so many people sick. So I don't think it's the medication it's on. I think it's how it's being, used and how it's being abused without the proper support,
Guidance.
nutrition, and guidance. So, I think that, and in the red Trudotide is going to be, there is just no
Yeah,
way. There's way
it's
too many
next.
people already seeing incredible results with that. So, you
And
know,
just to piggyback on that, Patricia, like you said, to kind of elaborate, that's typically the protocol with those GLPs. It's this dose for 4 weeks, and then you go to this dose for 4 weeks, and then you go to and it's just a constant titration. But to me, if you're still seeing and losing weight at the small I'm not going to bump you up. It's clearly working. You're losing the weight. You're tolerating it well. Why am I bumping you up in 4 weeks just because it's been 4 weeks? So I have had a lot of patients that have come over from physicians and got it from their insurance or provider, just because of the lack of guidance and direction. They were just kind of given the medication and then they're caught Googling things. So I just the way that I kind of delegate things is a little bit more catered to the individual specifically. Depending on that patient and how they're responding is how that dose is administered. And we may not go up in 4 weeks because you're responding well at that dose. I'm going to keep you there. In my mind, there's no reason to continue titrating you up if you're responding well to the lower dose.
yeah. Mary's asking, should I be concerned about the cardiac and gastrointestinal side effects of erythritide?
I mean, everyone's different, but for what's been seen thus far, it looks like that there's less GI issues compared to the semaglutide. From what I've seen, again, I've had patients on semaglutide, I've had them on tirzepatide, I have them on retatrutide. Semaglutide seemed to have the most side effects, especially when it came to GI issues, and nausea. So tirzepatide seemed to be a little better tolerated. I think it was kind of hit and miss. Some still kind of experienced it, maybe not as much. So far with the retatrutide, it's really been seeing good results as far as feedback and the toleration and response to it. Again, everyone's different. I can't speak that you'll not have those issues whatsoever. Those will be under the side effects checklist, nausea, GI, things like that. But when you compare it to the other GLPs in the past, this one seems to be a little bit better tolerated.
Yeah. And if you are in the program and you are doing this under my supervision, you will be doing gut protocols pretty often to make sure that we are supporting your gut lining, make sure that your microbiome is in a good place, and making sure that you are not abusing this thing. This is not, a magic like we keep talking here, and not everybody is a candidate for therapy. Some of you do not need this. Some of you will need this, right? So, but that doesn't mean you have to. You see what I'm saying? I have a client that took her 2 years to make the decision. We tried everything under the sun with her, absolutely everything that I knew. I was just like, girl, I don't know what else to do. Like your body's just not, maybe one day it will, but it's just not, it's not doing it. And she went on a very small little dose. She's been on it for a year and a half, and finally she lost the weight. But it took her 90 days to start losing weight. 90 days. This is how small the dosage is, but we were very conservative just to continue helping her with her gut protocols, with the flush protocols, so she could do this properly. And now she's, a happy camper, and now she's actually getting off of it. So, I think that there is the right way to do this. And once again, there is the way that people just abusing. So if someone cannot lose weight with diet and exercise, then we would try, will they keep a lower weight? Then how will they keep a lower weight once starting and getting the medication off? Sorry, I'm having a hard time with that question. If someone cannot lose weight with diet and exercise, then how will they keep a lower weight once starting and getting off of the weight loss medication? Oh, this is exactly what we're talking about, right? So throughout the time that you are on a medication, and you can speak on that too, Josh, is you want to make sure that we are continuously working with your nutrition, with your training, making sure that you are feeding properly, making sure that your liver is, your liver pathways are detoxified, that your gut is in a good place, right? So we continue working on your blood work while you are on this medication, to the point that your blood work is so good that now you can get off and not gain that weight back. That's how I see this process. How about you, Josh?
No, I agree. I mean, that's probably one of the bigger questions I get asked is will the weight come back? Once they stop the medication, that's great, but will the weight come back? And I tell them the same answer every time. You go back to the old habits, absolutely. You go back to, exercising whenever you can, or, the fast food or the fry foods or the kind of the grazing at night before bed. You go back to those, absolutely. Like that, the weight is coming back. The goal here is to instill healthy lifestyle changes. So by doing this over a course of numerous months, instilling those habits. So when you do come off the medication, you continue with those healthy habits, exercising weekly, making the right diet modifications. Like I said, Patricia with the she does this thing with the gut and the gut cleanse. Keeping up with that, you stop the medication and those things, absolutely. You're going to go backwards and the weight's coming back. It's that's just like I said. There's no magic pill here. You don't take it one time, it never comes back. That happens. We'll be millionaires if we ever find that medication. So it's instilling those habits long term. And I've had patients that are off the medication now. They got through the goal weight, and they've stayed off of it. To this day, they're not back on the GLP, but they are exercising like they did when they were on it. Their portion controls are where they were when they were on it, smaller. They're eating. They cut out the snacking. They cut out the fast food. They continued with those those lifestyle habits, and I follow up with them to this day, and they're still right where they wanted to be at their ideal goal weight. So that's kind of what we're trying to instill with this medication is again, supplementing your lifestyle habits so we can continue with that as we get off the medication in the long run.
Yeah, do I don't, like I said before, I don't believe, okay, which one do I do? So you're coming to me, you are one that hasn't really optimized your nutrition, you haven't really worked on your blood work, you haven't really worked on your gut, and you are telling me you're going to go on this medication. I'm going to be the first one to tell you, no, I don't think you should be on the medication yet. Now let's optimize everything first because this is a supplementation, like Joshua was saying. That's the part that you girls need to understand, right? If you are just going to do it just for the sake because you are frustrated, you want to lose weight, but your nutrition is crappy, your stress management is awful, you are not sleeping well, there's no recovery there, and then on top of that, you're going to put a medication when your gut is already a mess, you are shooting yourself on the foot. That's not the way to do. That's why these people are throwing all these lawsuits because that's exactly what they did. They came in already sedentary. They came in already eat like shit. Probably all already overweight, obese. If you are overweight, you know you didn't get there because you were eating healthy, right? And now on top of that, you put a medication. You are asking for trouble, right? A medication that will downregulate your gut. Like, hello, like common sense, right? Let's first optimize everything because maybe you don't even need that. Maybe once you optimize, you're going to be good. Maybe you just need how can I say, a peptide, like what can I say, like a tesamorelin, maybe,
I, I'm,
right?
I'm so proud of you, Patricia.
Let's go. Let's go talk about the tesamorelin.
You
Maybe you
nailed
won't
it.
need
I
that.
had it on the tip of my tongue, but you just took it. I
Right?
was
So go with the tesamorelin because I am on
Uh, yes,
tesamorelin. I
testosterone.
freaking love that
So,
thing.
as Patricia said, another great peptide actually has been FDA approved for the reduction of visceral fat. They've done studies on
Let's
HIV
go.
patients. It's one of the side effects with the disease, um, increased visceral fat. And this peptide, tesamorelin, has been FDA approved for the reduction of visceral fat. So really great results with that. And also is a growth hormone releasing hormone. So what it does is it mimics our growth hormone production endogenously. So it sends signals to our pituitary gland basically telling our own growth hormone production to kind of ramp it up. As we age, as we know, nature of the beast, our growth hormone production declines. This is why it's usually a little more difficult to lose weight. It's a little more difficult to increase lean muscle. Our recovery time is a little more difficult, and all our anti-aging, our hair growth, nail growth, skin elasticity, those things tend to decline.
Sleeping better.
So Desimorilin, as I said,
Sex, hello, more libido. Okay, I'm just
Tesamorelin
telling you,
increases our
girls.
growth hormone production. So, and like I said, like Patricia said, FDA approved for the reduction of visceral fat. So that's a great example. There has been patients that's come along that we did not do GLP with. They weren't
Correct.
a candidate. That wasn't them. Wrong place, wrong time. So we
Hmm.
went another direction with Tessa Moreland, and they seen. I think Patricia, you told me one of your patients 2 inches on her waist. I think she
Yep.
lost.
2 inches, 2 inches
Yeah,
on
I
the waist.
mean,
Yeah.
so it's there are other avenues to go. It's GLP is not the right all end all. There's other ways we can go. There's other peptides we can discuss.
Yeah.
And I commend Patricia for bringing that one up. That was on the tip of my tongue. It's another great peptide. A little different as far as it's 5 nights a week instead of the GLP, which is just once a week.
Yeah.
But easy administration, subcutaneous. And again, I have quite a few patients that have gone that route instead of the GLP route and are seeing
Mhm.
great results with body composition, the way they're feeling, improved
Yeah.
sleep quality. Again, a great
Skin,
pivot
nails,
option.
everything.
Yeah, and then
Yeah.
yeah, exactly. With the other benefits of increased growth hormone is your anti-aging benefits, like Patricia just said. Hair growth, nail growth, skin elasticity, those it all correlates to your growth hormone production.
Yeah. So now you ladies know my secret of my
So proud. I'm so proud.
No, but it's true, right? So I just was seeing today the whole thing about, visceral fat for women in perimenopause and menopause. That's a thing, right? And Tessa is the way to go. I don't even know how to say the name
Tessa
correctly.
Moreland, that's
Yeah,
close
it's
enough.
the way to go if you really want to work on that. I mean, if you really want to work, and now you do want to work because that visceral fat is dangerous, right? So, anyways, I don't know. Anybody has any other questions? I'm all for, optimizing. If nutrition is optimized, train is optimized, stress management is optimized, and you still not where you want to be, I think peptides depend. Obviously, everybody's different, and obviously, we can always have you have a free consultation with Josh, to discuss. I mean, I have a client. She's an oncologist, a big researcher. She adores working with Josh. And I don't know. I've seen great results from myself, especially when I was really stuck. And turning 50 was not I was just like, what the heck just happened? It really did for me. But I'm just so grateful that we have these tools, and and it's working for me, and I'm loving it. And I'm here just to share with you ladies the options, okay? Because if it was just fitness and nutrition, awesome. But if there is other things that is not going to harm you, that you can try for a 12-week cycle. Josh always gives 10% off for our clients, and I don't make any money off of this. I'm literally like, hey, the same way that we do with the HRT clinic, can I just be a resource for my clients for the things that I can give it to them? Does that make sense? So anybody has any other questions? How long on average are people particular on a particular peptide, for example, the peptide BPC 157?
The BPC 157 in particular, it depends. So if we're using it for soft tissue repair, maybe after an injury, things like that, longer course. Like I said, it's gonna you're repairing a soft tissue, a tendon, a ligament, things like that. Everyone's different. So there's really no kind of cut dry answer there. I've seen, like I said, patients use courses 8 to 12 weeks throughout their whole rehabilitation process, just to kind of help speed that process up, keep the inflammation down. Obviously, we know with injury and post-procedural, the inflammation is very high. So keeping that inflammation down was key. Again, with my other example I used for my close friend and client with the breast augmentation, she noticed it in a week. I kind of was chuckling because I thought maybe it was more of a placebo effect. And I was like, no, that's great. Yeah, I'm sure it's working well. She's like, no, no, you don't think you understand. I'm getting both my hands over my head. So it's per individual. That definitely depends on the person. Definitely depends on the severity of the injury. If it's for gut health, maybe a little bit quicker of a response. Um, but again, it depends on the individual. I know some patients have seen, as far as the gut health and response, could be within the first couple of weeks. But for soft tissue repair, especially if it's a full tear or if it's a surgery or you're trying to bypass surgery, it's going to be a little bit longer course. It could be 8 to 12, if not longer.
And tesamorelin, we can be on for 6 months, right? On end.
That's another good question. So tesamorelin, so it's about a 6 to 8 week ramp up time, meaning for the peptide to kind of build up in the body, get the optimal, most effective results. And then I usually recommend, like Patricia said, a 6 month is like a rule of thumb. I've had patients go past that because they're still responding to it. So, hey, it's still working. That's great. 6 months I usually use as a rule of thumb. Typically what will happen is your receptors will become desensitized to the peptide. So it's just not working as effectively. So
Yeah.
what you saw in the very beginning, you start to see diminish as it goes on. It's normal, nothing to panic about. I usually tell the patient take about a 30-day break, 45-day break,
Mhm.
let the receptors reboot, and then we can go continue on course. But again, 6 months is usually my rule of thumb. Not to say that I've had patients go on a little bit longer just because they still felt good. They were still responding well to it. So we pushed it past that a little bit farther. But that's usually what I try to keep an eye on, is if you're still seeing the results and the effectiveness, because sometimes as it continued use prolongs, you'll get a little desensitized to the peptide.
Yeah, we have a client that she has been on for 4 months and she lost
Mhm.
4 inches off her waist.
Oh, that's You didn't tell me that. It's fantastic.
Yeah, like I'm not
Oh,
gonna say
I
names,
love it.
but yeah, she lost 4 inches, and I'm like, bitch, I need that result, you know? Like, why can I not get that results? So everybody's different, right? So, quick question here. I love this question, Jenna, and I love that you are on the call because this is something that I've been thinking about since we talked today, Jenna. But what do you think about the NAD, Josh, in terms of, how that works?
Phenomenal. If you're talking about just overall longevity and well-being, so it's not a peptide, it's a coenzyme. Our body naturally produces NAD. As we age, unfortunately, like everything else, our NAD production declines. But that's okay. We have NAD. We can do injectable. My recommendation is usually injectable. It's easier to administer. You can do intravenously. It's a tedious process. I tell patients to be very diligent on who has you do the IV. It needs to be monitored very closely, and it's typically 3 to 4 hours of administration. You can have increased heart rate, nausea. It's just got to be very diligently overlooked. But as far as the injections that most of my patients are on, it's 3 days a week, subcutaneous injection. It's going to help with cognitive function. Um, it's going to help with inflammation as well, not to the same extent as maybe BPC and TB and KPV, but it still helps with a little bit of the inflammation. And it's going to help with rejuvenation and repairs of cellular damage and DNA repair as well. So as we age, the NAD uh, production declines, which is why our DNA usually ages, our cellular process slows down. That NAD helps to again rejuvenate and repair those damaged and DNA and cellular cells as well.
Okay. Yeah, I have some friends that told me that they have like a little bit of ADD and that has helped them become more focused.
Yeah,
And it's
NAD's
just that I'm in so many things right now because I'm like,
NAD's great just as a building block. Most people
right.
great candidates for it. Again, for just overall well-being and longevity, NAD's a great coenzyme supplement to any protocol.
Okay, so final question, because it's almost 6 here, girls. Okay, so I have a client that is she very low on testosterone. However, we ran her Dutch test and her alpha she's like very dominant on her alpha instead of the beta, right? On her androgens. So if she would be on testosterone, she would potentially have the negative side effects of, acne, maybe hair loss, and some other things that, could potentially happen there. So I know that there is, you could take a medication together with the testosterone to avoid those side effects. However, I also heard that that medication kind of blocks a little bit of the effects of the testosterone that you want to have. So question is for somebody that is dealing with that, you know, what do we recommend? Because I was thinking that another option for her, if she doesn't want to deal with the acne and all the crappy stuff that happens with, testosterone for some people, would tesamorelin be the option for her? Because obviously we're talking about here, muscle growth, right?
Mhm.
She's crushing in a gym and can build a muscle for nothing
Mhm.
because which is interesting because she has, her alpha is pretty dominant. She just doesn't have testosterone. But it may be, I don't know, DHEA. I don't know. What is your take on this to help her if she could not take testosterone?
So it's a good question. So you're talking about two different hormones. So you have your testosterone production, which she's implementing testosterone, either cream or injection, whatever she's doing to administer. And then you have testosterone, which targets the growth hormone production. So they're two separate hormones that we're targeting here. So they don't really kind of coincide with each other. I have patients, quite a few patients, that are doing hormone therapy with their peptide therapy. So we're getting our hormone production optimized, and we're getting our growth hormone production optimized.
Yeah.
So yes, in a sense, testosterone may help with her body composition, helping with increasing lean muscle mass. Obviously, doing that with exercise and diet. You're not just doing the peptide and laying in bed waiting for the miracle to happen. Um, but they target different hormones. So not necessarily implementing testosterone is going to increase her testosterone production. But in the same sense, like I said, if she's looking for helping to optimize her body composition, increase lean muscle mass, things of that, then yes, testosterone could be a great option for her. Like I said, but in the same breath, using them in conjunction with each other is also obviously very wise to do as well.
But if she's not a candidate for testosterone, then
Oh yeah,
she would benefit from
she could
tesamorelin
do testosterone, yeah,
instead.
for sure. Yeah.
And what do we do with the brain fog if the brain fog is happening from
We do have, so there are other peptides. I mean, NAD, like we just spoke with, that
that,
helps with
right?
cognitive function. There's other peptides out there that helps with brain fog. Usually hormone therapy or testosterone replacement usually obviously helps with that.
Yeah.
Cmax, synaptin. I mean, these are other peptides. They're nasal sprays.
Mm,
I have maybe a couple on them. They again, they do help with anxiety, depression, cognitive function, things like that.
mm,
Um, if she's really kind of hone it, if it's mental clarity and cognitive function, I would say NAD would be her probably your best bet. If she's
right.
not getting the brain, still having the brain fog with the TRT, like I said, as far as again, brain fog, uh,
Yeah.
mental clarity, NAD would probably be her best route to
So
go.
we could do a combo of NAD and
Oh
tesamorelin if
yeah, I have
you cannot have
absolutely, I have
testosterone.
quite a few on that combo for sure.
All right,
Absolutely.
so there is different ways to, so I'm not gonna say to skin the cat. If we can do one way, we can do another way. But you can still build some muscle there, girl, and feel better, even if you can't be on testosterone for whatever reason. Then, tesamorelin can help probably a little bit with your libido. And Josh maybe give you more stuff. I'm not saying names, okay? So nobody heard me saying any name, right? But if you need that, I think the end of the day, like whatever I needed to take to help me feel better and optimized. One thing that I noticed, Josh, with I don't know if you noticed that with your people there, but women that are post-menopause are doing much better than the women that are perimenopause and menopause.
I never made that correlation, but I guess it makes sense in the sense that as we age, our growth hormone production declines more so. So, increasing that growth hormone production through peptide therapy, you may see a little bit more dramatic of a result and effect as someone that may be a little bit younger who still has a mild, maybe a little bit better edge on her growth hormone production. So I haven't done a side by side comparison, but there could be something to be said about that.
Okay.
Interesting.
All right, girls. I hope that you enjoyed this call. If anybody wants to have a consultation with Josh, just let us know. We'll put it on the, thread on the email, whatever, and he will take you in just to, figure out what's going on with you and see what is the best course of action. Appreciate you so much. And, thank you for a fantastic question. I mean,
Thank you for
fantastic and moving
thank you for having me. It's
question.
always a pleasure. I appreciate you guys.
All right. Have a good evening, girls. Thank you.
Guys, have a
Bye.
good night.